In the next few minutes, I'm going to share something that could be the difference between maintaining penile sensitivity for the next 20 years, or losing it completely. Every time you engage in solo activity without lubrication after 50, you risk microdamage to nerves that won't regenerate. By the time you notice reduced sensitivity, you've already lost up to 40% of function. But certain oils applied correctly can help protect nerves, restore elasticity, and maintain firmness naturally. Why oils matter? As we age, 3 things happen. Natural oil production drops by 60%, blood vessels lose flexibility, and nerve sensitivity declines from decades of friction. The right oils solve all 3 problems. They lubricate, improve circulation, and nourish nerves through transdermal absorption. Studies show certain fatty acids can improve local blood flow within 30 minutes of topical use. This isn't hype. It's biology working in your favor. Oil number 1: argan oil. Argan oil, used for centuries in Morocco, is the gold standard. It has the highest vitamin E content of any natural oil. Vitamin E repairs damaged skin and improves elasticity, while squalene mimics your natural sebum for deep absorption. Once absorbed, it improves blood vessel dilation. Men using argan oil consistently report firmer erections lasting 20 to 30% longer. Use half a teaspoon, warmed in your hands, applied with upward strokes. Oil number 2: grapeseed oil. Light but powerful, grapeseed oil is rich in proanthocyanidins, compounds that strengthen blood vessel walls. Stronger vessels mean better firmness. French studies show topical use improves circulation by up to 40%. It also has 70% linoleic acid, which both protects skin and allows nutrients to penetrate. Use 1 teaspoon in circular motions. It absorbs quickly, so keep a pump bottle nearby for easy reapplication during longer sessions. Oil number 3: black seed oil. Black seed oil contains thymoquinone, which supports testosterone production and increases nitric oxide, the same pathway targeted by prescription ED drugs. It also reduces inflammation, a hidden killer of sensitivity. Use it diluted. Half black seed oil, half coconut oil. Apply 15 minutes before activity. A mild warming sensation is normal. It's the sign of improved blood flow. Oil number 4: jojoba oil. Jojoba isn't really an oil. It's a liquid wax that perfectly mimics natural sebum. That means instant absorption. It's rich in zinc for testosterone support and B vitamins for nerve health. For men with declining sensitivity, regular use over 2 to 3 weeks often brings noticeable improvements. Apply just 3 to 4 drops. It spreads easily and doesn't go rancid, making it ideal for spontaneous use. Oil number 5: extra virgin olive oil. Don't underestimate olive oil. With 75% oleic acid, it penetrates tissue barriers to deliver antioxidants and vitamin E. Mediterranean men, famous for lower rates of ED, use it abundantly. Its polyphenol improve endothelial function, making vessels more responsive to arousal signals. Use about a teaspoon of fresh, cold-pressed olive oil. Warm it slightly for comfort and better absorption. It's simple, affordable, and effective. Application protocol. Technique matters. Apply 15 to 20 minutes before activity to allow deeper absorption. Use upward strokes from base to tip for circulation support. Spend at least a minute applying, not rushed. Warm oil first under water for comfort. For extended sessions, reapply every 20 minutes. Pump bottles make it easy. This isn't just lubrication. It's therapy for your tissue. Safety and precautions. Always patch test on your forearm before genital use. Choose cold-pressed organic oils. Cheap refined ones can irritate. Remember, oils break down latex, so use non-latex protection if needed. Watch for irritation, unusual odor, or discharge. Rare, but if it happens, stop and consult a doctor. Done correctly, oils are safe and powerful. 30-day protocol. Here's the challenge. Give one oil a 7-day trial. Track your sensitivity, firmness, and comfort. Then switch the next week. By week 3, combine the best 2. By week 4, you'll know your ideal formula. Most men report week 1, less irritation. Week 2, stronger firmness. Week 3, better recovery. Week 4, sensitivity restored to a new normal. It's about consistency, not a quick fix. Gentlemen, this isn't about miracle cures. It's about protecting sensitive tissues before they're gone. A few drops of the right oil could mean the difference between decline and vitality. Start tonight. Choose one oil. Commit for 30 days. Your future self will thank you. If this message helped, hit like, share it with a friend, and subscribe for more real, science-backed guidance on men's health. I'm Dr. Zoe Hartley. Stay strong, stay curious, and I'll see you in the next video.